Hi everyone, this is Ginger Garner here with a new pose of the week. This particular pose of the week addresses the snarky psoas. Sometimes it's not just about having a tight psoas, and many times it is not about stretching it out. In fact, I find stretches to be quite counterproductive when I am treating someone who has pelvic pain, back pain, gut pain, SI joint pain. Did I say hip pain already? But basically pelvic girdle pain, and even pain up into the respiratory diaphragm and the vocal diaphragm as well, because those two things are intimately related. So if I was seeing you as a patient, I would be checking all three diaphragms. So the thing I wanted to talk about today relates to having a snarky psoas. Sometimes, again, it's not about tightness. The muscle can be shorter and weaker. And in lengthening the muscle, not by stretching, but by dynamically lengthening the muscle in a way that both lengthens and strengthens, sometimes the snark in the psoas begins to drop down. So this is a pretty simple maneuver that I have successfully used with patients. I've successfully used it on myself, and I'm sharing it with you today in hopes that maybe you could possibly get some benefit from it. Now, there are a couple of contraindications here. If you have a spinal fusion, if you have osteoporosis or osteopenia, or an active herniated disc that you're in therapy currently for, or pregnancy, then I would not recommend working on this one or doing this one. You start by sitting tall with your feet further away from you rather than close. So sit tall. I want you to nod the chin into the chest. I want you to scoop the belly out. You're not going to blow the belly out. No loaf of bread here. I want you to scoop it out, but fluidly exhale while you're scooping, okay? So fluidly exhale and lower yourself down. You can walk it with your hands, or if you have enough control, notice how as I'm coming down, I'm not ballooning the abdominals here. Then you're gonna roll it over to your side, press it back up, and do it again. Exhale, nod the chin into the chest, scoop the belly, scoop, scoop it out, scoop it out. Don't balloon the belly. Do it again. I'll demonstrate one more time. Scoop it out, exhale, 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 scoop, exhale, scoop, exhale, scoop. Now, you may do 2, 3 of these and feel the lengthen, strengthen benefits that you get from that, which can, again, downtrain the snark. You may have to do this experiment with it 7 or 10 times. I will say this, rarely does an isolated exercise fix everything, right? So what I recommend is that these pose of the week videos are great in little doses, but for a comprehensive look at why the psoas would be so snarky, I would see someone who's trained in both pelvic physical therapy and orthopedics, specifically focusing on the pelvic girdle. And one more tip, when you go find that person, that orthopelvic PT that specializes in this area, they should also be looking at your vocal diaphragm and your respiratory diaphragm. So just a couple of tips to make sure that you get yourself to the best physical therapy care that you can. Until next time, I hope that your snarky psoas is a little happier. Have a good one.